In this video, we're going to perform saucerization of your mastoidectomy cavity. Saucerization is a procedure by which the cavity is smoothed down to eliminate acute edges or bony overhangs as far as possible. This technique has many benefits. Intraoperatively, removing lateral bone and smoothing it provides far greater access for visualizing deeper structures, as well as allowing instruments in with a greater degree of angular freedom. One example of this is when trying to view or instrument the anterior epitympanum from the mastoid side. In a narrow cortical mastoidectomy, this is extremely difficult because the lateral bone covering the sinudural angle and sigmoid sinus does not allow the correct line of sight for your eye or your instrument. Once this bone is removed, however, you will find the angle much easier to view the anterior epitympanum. A second benefit of removing lateral bone is to allow light in to better illuminate the deeper structures. Removing air cells and trabeculae further improves your visualization as it removes shadows and the nooks and crannies that can trap and absorb the available light. Saucerization is also an important technique when performing modified radical mastoidectomy surgery because it eliminates sharp ledges laterally, which tend to tent up the soft tissues of the head and create an unnecessarily large mastoid cavity. By removing these ledges, and in some cases by removing the mastoid tip, the postauricular soft tissues are able to sag inwards, thereby partially obliterating the mastoid and ultimately leading to a smaller overall MRM cavity. Here, a large diamond burr is selected, typically 5 or 6 mm, and the bone is systematically removed as shown, with the aim of removing any sharp edges and creating a gentle curve that rises out from medially to become continuous with the side of the skull. This maneuver is repeated posteriorly over the sigmoid. Note that while some sigmoid sinuses are relatively flat and in line with the posterior fossa dura, others are quite prominent and anterior, and may actually rise proud, like a hill, higher than the surrounding posterior fossa plate. You will normally already be aware of this, having reviewed the pre-op CT scan images. The diamond drill essentially acts like a sanding machine and is normally more forgiving than a cutting burr when near soft structures like dura or sigmoid. You must nevertheless remain vigilant and avoid over-applying pressure or overheating the tissue from the friction. Notice that in saucerizing a cavity, you're often making it bigger. But do not be alarmed. This increasing size is usually more than compensated for by the ingress of postauricular soft tissues that it allows. For the avoidance of doubt, it should be said that you cannot saucerize the posterior canal wall in a canal wall up procedure, because by its nature this is a sharp, thin ledge. However, in a modified radical mastoidectomy, the posterior canal wall is taken down, and in this scenario, crafting a low facial ridge is part of the overall principle of good saucerization. Perform a cortical mastoidectomy and saucerize it in 5 left and 5 right temporal bones. You can choose to vary how widely you perform the saucerization depending on the procedure you're simulating and the access you wish to gain. For example, if your aim is to reach the cerebellopontine angle, then you need to skeletonize the dura. But if your aim is simply to access the deeper mastoid for cholesteatoma removal, you may wish to leave some bone on to protect these structures.